Between 1960 and 2015, the marketing of Nestlé's infant formula may have contributed to nearly 11 million infant deaths in low- and middle-income countries. It's a sentence that sounds like a conspiracy until you trace the evidence. 11 million infants. It's not a number you can really picture. It's more than the population of an entire nation, gone before the age of 1. But this isn't the story of a single event. It's the story of how slow, systemic harm can unfold quietly, invisibly, over decades, in the space between marketing, poverty, and trust. In the 1960s, Nestlé was expanding faster than almost any other food company in the world. Its products were everywhere: coffee, chocolate, powdered milk. The next step was clear: to turn its infant formula into a global staple. At the time, formula was already common in Europe and North America. It was seen as modern, scientific, clean, a sign of progress. Nestlé's marketing echoed this sentiment. Glossy ads showed happy babies, healthy mothers, and doctors recommending powdered milk as a safe, advanced alternative to breastfeeding. But what worked in Geneva or New York was catastrophic in rural Kenya, the Philippines, or India. Nestlé ES representatives, many dressed in white coats to resemble medical staff, went from village to village distributing free samples to new mothers. The samples lasted long enough for their natural milk to dry up. When the samples ran out, mothers had no choice but to buy more. The formula had become a necessity. In hospitals, newborns were sometimes given formula before they even took their first breastfeed. Posters and brochures promised that powdered milk was as good as or better than breast milk. Nestlé's formula was not inherently dangerous, but in places without clean water or sanitation, it became a lethal risk. Powdered milk must be mixed with water, and in many of these regions, water carried disease. Boiling required fuel and time that many families didn't have. Measuring the right ratio was difficult, and because the formula was expensive, parents often diluted it to make it last longer. Babies starved slowly, invisibly, between doses of what they were told was nourishment. By the mid-1970s, doctors and aid workers began noticing patterns. Infants who had been switched from breast milk to formula were dying of diarrhea, dehydration, and malnutrition at alarming rates. Public health journals began publishing reports. Missionaries wrote letters to newspapers, and in 1974, the British organization War on Want released a report titled The Baby Killer. The report accused Nestlé of unethical marketing, of preying on the poor and uneducated, of turning something as natural and free as breastfeeding into a commercial product. Nestlé called the report a smear campaign. But the outrage spread. Churches, student groups, and activists around the world began organizing boycotts. The protest became one of the first major global consumer movements, uniting people from the United States, Europe, and the developing world under one slogan: Nestlé kills babies. In 1981, under mounting pressure, the World Health Assembly passed the International Code of Marketing of Breast Milk Substitutes. It was the first attempt to regulate how formula could be advertised and sold. The code banned direct advertising to mothers, outlawed free samples to hospitals, and required warnings on packaging. Nestlé agreed to comply. But compliance was uneven. Enforcement depended on local governments, and in many poor countries, oversight was weak. In some places, the same practices continued under new disguises: subtle promotions, medical sponsorships, or quiet partnerships with health workers. Even as public attention moved on, formula sales kept growing. Decades later, in 2018, a group of economists revisited the issue using modern data. Their paper, published through the National Bureau of Economic Research, tried to measure the long-term impact of Nestlé's formula expansion. They studied millions of births across 38 countries, comparing infant mortality rates before and after Nestlé entered each market. They paid special attention to whether households had access to clean water. The results were shocking but consistent with the older warnings. In areas with unsafe water, the introduction of Nestlé's formula corresponded with sharp increases in infant deaths. In areas with clean water, the pattern didn't appear. Using statistical models, the researchers estimated the cumulative toll: roughly 10.9 million infant deaths over 55 years, deaths that likely wouldn't have occurred without the Formula S presence. 11 million lives in the space between a bottle and a stream of contaminated water. Numbers can feel abstract. 11 million doesn't sound like the screaming of a single hungry child or the silence of a grieving mother. But that number carries a moral geometry. It reveals what happens when marketing outruns ethics. Nestlé didn't intend to kill babies, but intention doesn't erase impact. The company's campaigns reshaped cultural norms, turning breastfeeding, a public good, into a private choice mediated by profit. It persuaded mothers that their bodies were insufficient. It replaced trust in community with trust in corporate science. And when deaths began to rise, the company insisted the blame belonged elsewhere, on bad water, poverty, ignorance. But those conditions were the very environment in which Nestlé chose to sell its product. Nestlé's official stance has always been the same. The company supports breastfeeding, complies with international standards, and provides formula safely for mothers who cannot nurse. The company argues that formula saves lives where breastfeeding isn't possible, for example, when a mother is malnourished, ill, or working long hours. And that's true. In the right context, formula can be life-saving. But critics argue that Nestlé's marketing blurred the line between choice and dependence. In many regions, mothers didn't have the resources or information to choose safely, and once breastfeeding stopped, choice was gone. Even after the outrage faded, the patterns continued in subtler ways. In 2023, investigative journalists found that Nestlé was still marketing baby food differently across the world. In wealthier nations, its infant cereals met strict sugar guidelines. In poorer countries, the same products contained added sugars and sweeteners, ingredients that hook babies early and contribute to obesity and diabetes later in life. The company defended its regional formulations, citing taste preferences and affordability. But the divide is clear: a healthier product for the rich, a sweeter one for the poor. The logic hasn't changed, it's only evolved. It's easy to treat Nestlé as the villain, but the story is bigger. Other companies also sold formula in unsafe contexts. Governments failed to regulate. Hospitals took sponsorships. Consumers in rich countries looked away. Nestlé is not a singular monster. It's a mirror reflecting a world that still puts profit above precaution. Even today, global health campaigns struggle against similar forces. In many low-income regions, companies market ultra-processed foods, sugary drinks, and cheap baby snacks as symbols of modern life, while local diets collapse and health systems strain under rising rates of diabetes and malnutrition. History repeats itself, just in different packaging. The Nestlé case teaches something uncomfortable about globalization. Technology and trade spread fast, but ethics lag behind. A product that's safe in Zurich can be deadly in Zambia. Not because the formula changed, but because the world it enters isn't built for it. When companies expand into fragile systems, without clean water, without education, without regulation, they don't just sell a product. They inherit responsibility for the consequences. This isn't about demonizing science or business. It's about humility. The humility to ask, should we? Instead of just, can we? For the mothers who lost children, the debate over data doesn't matter. For the researchers, the 11 million figure is a calculation. For the rest of us, it's a moral haunting. Each number represents a story. A mother mixing powder with river water because she thought it was safe. A baby crying through the night. A grave dug in red soil. Those stories don't appear in Nestlé's annual reports or its sustainability pledges, but they exist. echoing beneath the brand's smooth corporate language about nutrition and trust. Today, Nestlé remains one of the largest food companies on Earth. It sells baby formula in more than 150 countries. It publishes corporate social responsibility reports, emphasizing compliance with the WHO code. And yet, the legacy of mistrust remains. Activists still monitor Nestlé's practices. Health organizations still warn about inappropriate marketing. And families in some parts of the world still struggle with the consequences of past misinformation. It's easy to believe such controversies belong to another era, that modern corporations have learned. But every few years, a new report surfaces. Aggressive sales tactics, misleading promotions, quiet lobbying against stronger regulation. The story keeps repeating because the underlying incentive, profit growth, never changes. $11 million. It's more than a number. It's a mirror, reflecting what happens when progress loses its conscience. It is a reminder that the distance between a corporate office and a village well can be measured not in miles, but in lives. Nestlé's story is not just about formula. It's about the intersection of science, capitalism, and human vulnerability. It's about how easily a product can shift from life-saving to life-taking when context is ignored. When we talk about Nestlé 11 million, we're not only talking about the past. We were talking about a pattern that still defines the modern world, the belief that if something is profitable, it must be good. But profit doesn't bury the dead. The lesson is as stark as it is simple. Global power demands global responsibility. If corporations can reach everywhere, their ethics must too. The number 11 million isn't there to shock. It's there to remind, to make sure that the next time a company claims to feed the world, we ask whose hunger they are truly satisfying and at what cost.